Of course, yeah.
They didn't make it up.
I can say, yeah, if you think your life is peaceful now.
Right.
All right.
Okay, well, we're on the air with Facebook Live, and you can hear Harper crying there. She's only 4 weeks old. And so Patrick and Julie are here with us. I can't believe it. First place, I can't believe you delivered a baby a month ago.
Yes.
You look like you're a fitness coach and you're back to work.
I do teach some fitness, so I'm glad. I hope to go back to work soon.
Well, so, I don't want to say it in the wrong way, but you're not so young.
Correct.
You look really young. I mean, you really do look like you're in your 20s, but...
I'll be 36 next week.
I know.
Yes.
So what is your story then?
Patrick and I got married later in life. If I need to pick her up, let me know.
We'll pick her up. Yeah. We thought we'd get started and then show her off.
Well, she sleeps through a live band.
Yeah.
Whenever it's quiet, she decides to cry.
So this is Harper. Patrick
Make
and
sure we have a good view.
There she is. Yeah, you just wanted to be on TV. Patrick and I got married later in life. I was 33 when we got married, so we knew that we were already a little bit behind the curve on everybody else. And we eventually started to try, and we had trouble. I wasn't ovulating, but we didn't know why. So after working with my gynecologist, she realized that I needed more assistance. So they sent us to Dr. Pineda, who worked.
My partner, who just retired, unfortunately, but
he was great.
Yeah,
and
he was great.
On first meeting, he said our situation was more severe, and that he wanted us to meet Dr. Silber. So we did, and we came in, and he finally was the first doctor to give me a diagnosis of PCOS. Which was kind of very exciting because we never knew what was wrong. We never knew why it wasn't working.
And it's interesting because PCOS, many of you out there probably are wondering about this because some doctors have this view that it's usually an overweight woman with skin problems. That's not necessarily the case. So tell us about your PCOS.
So my PCOS, I never had consistent periods in life. And so that was kind of number one. But I wasn't ovulating, and I never knew that. So my chances of getting pregnant were slim to none because there was nothing happening. So then Dr. Silber let us know that IVF or mini IVF would be a good option for us.
Right. So mini IVF is great because PCOS is often associated with a huge number of eggs. Well, let's get her on the screen. Let's see her.
There she is.
And so if you stimulate the patient just for ovulation induction, often you're worried that you'll have too many ovulating and you'll have a dangerous multiple pregnancy.
Yes.
And even with IVF, you worry about hyperstimulation syndrome. So we go with mini IVF, minimal stimulation. We get the best quality eggs, and we got beautiful blastocysts.
Yes.
And that was the approach. This mini IVF protocol, we used to use it only for older women with very low numbers of eggs. But no matter what age you look at it now, it's the best approach.
Yes, it was great for us. We ended up getting, I think, 18 eggs somewhere. Is that something right, Patrick? Somewhere in there? Do you have it written down?
5 fertile, actually.
When we came out, and then we had 5 blastocysts at the end of that. So
17 eggs and 15 fertilized.
Yeah.
And 5 blastocysts.
So we were very, 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 very blessed to have that many come out.
But you didn't have symptoms of hyperstimulation.
No. So I nothing seemed to go really wrong during the retrieval process during that point.
Yeah. So we're really happy with it, everything. Now, there are 2 types of mini IVF, and the type that we used with you was where you took shots, but extremely low dose shots.
Correct.
Yeah. We were afraid that if we used the other mini IVF protocol, because of your irregular cycles, you might not get anything at all.
Correct.
So we still have another blastocyst.
Yes, we have one saved. We definitely have one saved.
So it's interesting. So what I told you about PCOS, if you'll recall, it's a very interesting condition. You have so many eggs, and at some point in time, when you're maybe 40 or 42 and the eggs aren't so fertile, your cycles will become more regular.
Yes, that's what you told me.
Yeah, because less eggs, and so better elevation of FSH in the first part of your cycle. So a lot of PCOS women go undiagnosed, or they wind up trying stimulation with IUI and they never quite get it right, or they're always in fear of multiple pregnancy. So I found that it's better to be on birth control pills when you're not trying to get pregnant.
Okay.
Regular cycles,
Right.
and it's better, and to do IVF when you are trying to get pregnant. So there's a perfect.
And it worked for us. Of course, the first time she's been fussy.
This is amazing because we thought she is not a fussy baby. Actually.
Yeah, she's not at all.
But I think she's got.
I think she's mad that she's not more on camera.
Yeah, you want to be on camera
Yeah,
more?
no, I agree with that.
You know?
She needs to be centered.
Here, let's get you in so you can see more.
Let's get
There
her.
you
Let
are.
me get out of the way. Let's get her
Here,
in there.
say hi to everybody. Here.
I don't know if you guys ever officially met, did you?
Yep.
No,
Harper,
this is
I
my
don't know.
first
Well,
Dr. Silber.
I mean, it was
First
for a
time.
split second.
It's my
Anyway.
first time. She's really beautiful.
Thank
really,
you.
Really
We're
happy.
very
Very
blessed.
sweet.
Yes.
We're very blessed.
So how long were you trying?
So we tried with on our own for about 6 months.
Mm-hmm.
After that, we tried with the help of Clomid from our gynecologist for about 4 months.
Did that do anything? Did it move the needle?
Nothing.
No, I was
Did
afraid it
nothing.
wouldn't. I was afraid it wouldn't.
And
It
that's
did
when
a lot.
it made me a
just
little bit
not
crazy.
results.
Yeah. It was a little bit crazy. And that's when my doctor realized that it was time to go to Dr. Pineda.
Mm-hmm.
And we were with him for about 3 months total by the time we did all the different tests. We checked my tubes and we checked his sperm and to make sure that things were okay before we could come to you. So in total, a little over a year.
And you know what's interesting about this? Let's say you guys got married when you were 20,
Right.
like people used to do 3 generations ago. Even with PCOS, you might have gotten pregnant because if the eggs are so young when you're 20, that we have a typical story that they get pregnant, have a baby, despite irregular cycles, unpredictable cycles, and then they try to have their second baby and it doesn't work. They can't because they're in their late 20s now or early 30s, and they can't without IVF.
Okay. Well, it saved us. It was a miracle. Okay, I'm going to find your pre.
So,
Here,
do we have any questions?
Why is the baby crying?
Yes.
Oh, okay, so let me tell you
It
about
has
baby.
nothing to do with him.
Let me tell you about babies crying.
Yes.
Babies are supposed to cry. I'm going to give you a little lesson in early childhood development.
Okay.
Definitely. I love that.
Yeah. Everything that's really crucial in the baby's personality, intelligence, and character really forms itself in the first 2 or 3 years of life.
Okay.
A lot is happening. Now, a baby has every reason to cry. I mean, look at how helpless they are in this gigantic universe. They know it. They understand. They understand more than they can verbalize, and they know that they're pretty helpless. So they ought to cry. I mean, if they don't cry, sometimes they're just not aware of what a scary situation.
You needed to hear that.
My dad said that.
Yeah.
She's such a well-behaved baby that he was worried that she wasn't crying enough.
Until she came here.
Well, we have to go. Let's hear her.
No, but seriously, even though she's well behaved and she's really an easy baby, I can tell you why that's the case too. But she had to be crying a little bit.
Yes.
Right?
Yes.
Okay. So if you are scared and nervous and somehow or other troubled by the baby crying, and you hold the baby really, really tight because you're concerned, then she will understand that there's a reason to be crying. She will understand mom is insecure and dad is insecure, so maybe I should cry because this seems like a very insecure situation. That's what she's thinking without words, really. So, but if you feel comfortable like I see you do, you're a master at it.
Oh, thank you.
You just hold the baby because you're so happy for her and you know everything will be safe. Then she reads that and then she feels secure. And doing that in the first 8 months of life is crucial for her whole sense of self-esteem and security. Believe it or not, that's developing really, really, really early.
I'm glad she's taking the lead.
You can't spoil the baby in the first 8 months. I mean, you're just establishing a sense of security and well-being.
See, we can't spoil her right now. See?
Yep.
He thinks that we can
A
spoil her.
spoiler.
And one thing you got to get used to,
She
you're
is
no longer
so
number
spoiled.
one.
That's right.
You know you're not one number.
Oh, I know.
And that's for the rest of your life
It's been very
now.
clear. It's been
That's not
very
temporary.
clear.
That's funny.
So she's number one for both of you.
Yes.
But at any rate, so that's my lesson for you. You obviously don't need a lesson, but it's just an interesting observation. So those first 2 or 3 years are really, really, really important. And then when it comes time that she's going to be crawling, which will be in about 5 more months,
Okay.
that's when you baby-proof your house. You're not baby-proofing your house to protect your precious things. Your baby, and not even so much to protect her, though obviously you are. The reason you're baby-proofing the house is so that as she starts exploring the world by crawling, she comes across only natural restrictions.
Oh.
You don't have to say, no, don't go there, don't do that. You can be totally positive because she will come across those natural restrictions, the 4 walls. I mean, she's not going to really get anything that's going to hurt her. You're just going to have safe things there. And so her curiosity will not be stifled by your saying, oh, no, don't go near that.
Huh.
Yeah. So
Interesting.
I
See, we
recommend-
needed this. We needed some parenting.
Absolutely. What about 2 Yorkies and a bulldog?
Yeah.
Oh my gosh, I don't know what to do about that. I don't think
We'll figure that one out.
You better figure that one out.
Occasional.
Yes.
We do have a question.
Okay.
Julie would like to know, is there a time limit for frozen embryos?
So Julie wants to know if there's a time limit for frozen embryos, and that's a good question. Everybody worries about that. No, there's no time limit. These embryos will be good for 100 years. You can, in fact, if you store up embryos while you're young, because you're relatively young, but you're 34 now?
I'll be 36 next week.
36, okay.
Yeah.
If you store up your embryos now, then in 4 years, they'll be just as good as they are now. And in 10 years, they'll be just as good. So there is a movement. I don't want to sound overly aggressive. There is a movement afoot of patients doing several cycles to store up more embryos while they're younger, so that if they decide to have a second or third child when they're 40 or 42, they'll have 36-year-old embryos.
I actually have a couple of friends who are not with a significant other right now, but getting to the age of starting to worry, and they're considering freezing theirs so that they'll have them if they ever get to the point of at least having their eggs.
Yeah,
you know, that they have
freeze the eggs. I would recommend women freeze their eggs if they're not sure what they're going to do in the next few years. And you want to freeze them. You don't want to wait till you're 40 or 42 to start freezing your eggs, because many women don't meet the right guy or decide to settle down until they're 45. Even nowadays, it's a real modern world, and but then at 45, the chance of pregnancy from your eggs are going to be very low. It can happen, of course, but it's low.
Julie, were there any complications from your PCOS and your pregnancy?
I had complications during the pregnancy, but no one has attributed them to PCOS. I had a lot of swelling during my pregnancy that we might have got just misdiagnosed. I had some high blood pressure for myself. And during the actual delivery, I had an episode which was deemed seizure-like at the time, but nothing actually was. It was more we're thinking maybe an allergic reaction to medicine. So again, I did have complications, but nothing that has been told that was related to PCOS.
Yeah, the studies have shown, and there's about 10 million IVF babies now in the world.
Wow.
And there is no increased obstetric risk related to that, unless you have triplets or quadruplets or something like that. But frankly, the major cause of triplets or quadruplets, which is a scary, dangerous pregnancy, is not IVF, but just hyperstimulation. In other words, a woman comes in with PCOS, we want to make her ovulate, we're going to stimulate her so she'll ovulate. the problem with not doing that with IVF is she might have 3 or 4 ovulations, and almost all of the multiple pregnancies now that we're dealing with that are dangerous are coming not from IVF, but in fact, IVF is the safer approach than just stimulation.
And that was something that you did warn us about both times that we did this, that we would multiples were an option because of the stimulation. You did tell us that both times.
Yeah, but not if we restrict the number of embryos.
Correct.
Transfer. Yeah, so that's it. And now you see, we can, ever since 2003, we've been able to freeze embryos with vitrification. And actually, we were the first to bring that to the United States, but we learned it from Masashige Kuwayama in Tokyo, and we've been working with them ever since 2003. And that has changed everything, because now we're not afraid to freeze the embryos. We're not going to hurt them when we freeze them. But before 2003, it was always very scary, and you'd be tempted to transfer too many embryos because you knew that freezing would have problematic results. Now we can freeze with impunity.
Okay.
Yeah, we're very safe. Yeah.
What would you guys say to couples considering IVF?
It was a miracle for us, so it worked. She's living proof. I would say it wasn't easy. You agree with me, Pat?
Yeah, we entered this process pretty quickly after we got married. I mean, we tried immediately after we got married.
Yeah.
And then entered this process. So, it is a process. Like you said, we went to your OBGYN for a while. We tried the different things until we came to Doc.
It sort of takes over your
kind
life
of feel like
we
felt like we wasted a little bit of time. I almost wish we would have came here directly, but yeah, I mean, it puts a toll on you at times if you don't.
Yeah, you definitely want to be supportive of each other. There's a lot of shots. Poor Patrick had to give me shots in the mouth, or in the booty at night. And no one wants to give their shots to their
The reason you said mouth,
yeah, sure, they just fell out.
Because her little blinky just came out.
Yeah, baby brain. And it's a very timed process, and you're always checking in with the doctor and checking in with each other. So it is a little overwhelming, but obviously the end result is 100% worth it.
It's very stressful,
Yes.
being infertile. And we're trying to make it as least stressful as possible. I think the mini IVF let's see what you think, but I think it is easier and less stressful on your whole relationship. But does she have any hormonal swings from the...
Julie's been fantastic.
Okay, right.
I wasn't a very emotional hormonal person beforehand, so
you have to worry about me.
He got a little more emotional than I did. But I would highly suggest it. I would just say be prepared to go into it together, and just know that it's a lot. It's a lot.
Now the bad thing the worst thing is the progesterone shots, right?
Correct. Yeah. And that's the one that he had to give me every night. So prepare your significant other. It's not fun.
In America, most women prefer the progesterone shots. You do have an option of the vaginal suppositories, but usually women have to do that 3 times a day if it's going to work. And in America, women would just have that one miserable shot at night,
right,
and to worry about 3 times a day of suppositories.
Yeah, I dreaded 9 o'clock every night, but you could do it. Yeah, we made it work.
It got a lot easier.
It did get a lot easier. Yeah. It did. It definitely did.
And with the suppositories, they often forget to do it during the day, and then you have a 15% lower pregnancy rate. You really need to do it 3 times a day. So that's why there's different. In Europe, almost everybody uses suppositories.
Oh.
But everybody knows that our pregnancy rate in the U.S., we're no better than they are, believe me. They are great doctors there. But our pregnancy rate in the U.S. is way higher than in Europe. And I've analyzed this, and I think it's mostly because it's vaginal suppositories, and the women just don't remember to do it 3 times a day.
And it's hard if you're working and doing other things. It was already difficult to take pills and my own patches and things, so I can't imagine that.
Yeah. Well, great. Oh, great. So what was it like, though? Let's go through. I mean, it's all exciting. We're all excited, and I like to enthuse people out there about IVF. But what was it like to have a negative pregnancy test?
I went into a bit of a depression. it was about this time last year that we did our first round of IVF, and it was we kind of went into it that Dr. Silber this was it. We were going to do it, and not even though everyone had prepared us that it may not work, and the chances and the statistics, we just I guess didn't really listen. And
we were optimistic.
We were very optimistic, and we found out that it didn't work, and I didn't realize how hard it would hit me. It was sad. You put a lot of time and energy and money and effort and into that, and I went into a very dark place. Patrick had to help me. We read a lot of books. We actually called the office and asked if we could come talk to Dr. Silber, and they let us in immediately. He got us in the next day, actually, and sat and talked to us and explained to us what had happened and what he thought we should do again, and if we should try again. And after a lot of talking, we did another attempt, and it worked the second time for us.
You know, it is amazing, really, that when I saw you and I see someone that's had a negative result, it's important to be positive if that's the truth, and it was the truth. I mean, I knew that you'd be able to have a baby eventually, but it's hard for you emotionally to get into that.
Yes, I kind of just I was in that mindset of why can everybody else get pregnant and why can't we? And it was a very negative mindset at the time. And Patrick he had to just try to support me because he didn't understand what I was feeling.
I had to remind her, I said, hey, this is 50-50 almost, right? Yeah. Going into it. So we got another shot here, another 2 shots.
But we did get in the car, and I said immediately that Dr. Silber made me feel very welcome and very I was a different person when I came out of the meeting with him that day. And that day we went home and we emailed our nurse and we set up our second IVF that day. So
fantastic. Well, and we can do more. We have another embryo that I think is a real good one.
Easy.
Easy? Okay.
Easy. Easy.
Us guys have to stick together on this one.
Yeah, I mean,
it's okay not being
that's
number
like
one,
man
but
code. You just broke man code.
You don't want to be number 3, do you?
That's right. Baby steps for Patrick. She's only 4 weeks old.
I have 8 grandchildren from one son.
Wow.
And it seems like chaos, and people are shocked. I mean, they from 3 years of age to 19 years of age, but they really all love each other, and they can't imagine not having a big family.
Wow.
They can't imagine not having 7 brothers and sisters.
That's
so
good for them.
But it's chaotic. I mean,
it's definitely a basketball team.
Yeah, it definitely
absolutely. You got bench warmers and everything.
Wow, that's great.
As you guys were going through this process, how often were you visiting the doctor's office or going through tests or any kind of treatments?
Oh, okay. A lot, very often. You would come in, and Dr. Silber would meet with you, and then your nurse, our nurse was Mindy, she was fabulous, would give me a breakdown, and it would be exactly to the day. On this day you're going to do this. On this day you're going to do this. On this day, and it was basically coming in to do vaginal ultrasounds to check the progress of my, what are those called? The follicles. Thank you, baby brain again.
Your brain turns to mush.
Yeah.
It'll come back in a couple of years.
I hope so. So they would check my follicles, and then I would take medicine on the days that Mindy would tell me, and then they would schedule the appointment to come and do my egg retrieval, and then start the process over again for my transfer. Besides that, coming into the office was when we asked to come in, and we asked 2 different times to come in and meet with Dr. Silber outside of our normal appointments, and they always got us in immediately to talk to him.
Yeah. But also they were good, weren't they? I mean, to have a team of coordinators that are really sensitive and are really knowledgeable.
Yes.
I get so many patients coming in that have been at some centers that are like factories, and no one talks to them, and they feel like they're if they call up, they feel like they're intimidated because they feel like they're bothering people.
Yes.
So
Mindy was great, and I actually was the one that was I was more nervous to call because I felt that I might be bothering, and Patrick would always make the phone calls, and Mindy answered questions right away and got us in for anything that we needed. She was great.
I hit her up on Facebook a couple times too. It was easy
Oh,
to get in
did
touch
you?
with her. I'm teasing.
Yeah, she was really wonderful.
She was great.
Yeah, she was wonderful.
She is amazing. Yeah, but they're all amazing. They're, you have a specific coordinator, but all of them can pinch hit for each other, and I think that's crucial because if you're just depending on the doctor to answer the phone or to call you back at 8:00 at night, it's very disjointed. It's really important that whenever you do have a question, it gets answered right away.
And it definitely did. Even Mindy, she unfortunately had to deliver our news that it didn't work the first time, which no one wants to be that
Right.
person. And she was very consoling and very kind. Kind of let me cry it out. I was crying on the phone with her. So you definitely build a relationship with those nurses.
That's great.
Yeah.
Why do people have to wait a few months between egg retrievals?
Okay, so the question is, why do we have people wait a few months between egg retrievals? We just assume if they need to bank embryos, they're older, and we need to store up more embryos. The question is, why don't we just do it every month? If they're 43 years old, I really don't want them waiting 2 months, 3 months, or 4 months for the next retrieval to store up more embryos. I'd like to do it immediately. What we found out is, though, the results just aren't as good unless you give that ovary a month of rest. And I think here's the reason why. We know that you have an ovarian reserve we call primordial follicles that are all sitting on the outside of your ovary, and there's no hormonal control. Every day, 30 of them, if you have a normal ovarian reserve, leave that resting phase, and 4 months later, they become part of the ovulatory menstrual cycle. So when you're menstruating, there are follicles and eggs that began developing 3 months earlier, and you don't really see them until that final cycle. It's been 4 months of development during all your previous cycles, and it's automatic. It's not hormonally controlled. It's really pressure controlled. There's no rhyme or reason to it, but it's a very, very repeatable phenomenon that is not hormonally sensitive. So that's going to happen, and those eggs will be ready every month that started developing 4 months earlier. But their release from the primordial follicles is controlled by pressure. And so when you have increased pressure in your ovary, related to the fact that you have these follicles that developed, then you're going to have a poor development of follicles next month. Okay. So that's the reason why you have to have some ovarian rest. If we can do back-to-back cycles, we can do random start cycles. All those things work, but it's not as good as really having a fresh start from the beginning. So that's why we make you wait.
Okay.
What is one thing that occurred during your IVF process that you weren't expecting?
Number one, I wasn't expecting for it not to work the first time. Again, that was it was just our idea. Yeah. I wasn't expecting the progesterone shots. You told us about them, but I just didn't know.
You didn't anticipate how miserable that would be.
Yeah, and how long I would have to take those shots. We took those shots, I guess, 2 weeks prior to the
pregnancy.
Yes, and then we had to do it once we found out we were pregnant for another 10 weeks or something.
Yeah, but usually you only have to take it for 2 weeks if you don't get pregnant.
Okay.
And if you are pregnant, then you didn't mind that.
I didn't mind it at all. So that's So that was my thing, I guess. Yeah, and having to give myself shots was a little, I guess, scary at first. But once I figured it out, it was not a big deal at all. So.
Oh, that's great.
Christina says that her tubes have been burned, cut, and tied. Is that reversible? Or is it possible to have someone's fertilized egg implanted into her uterus?
Yeah, well, this is a woman that's had her tubal sterilization, and she has a choice. We could reconnect the tubes with microsurgery, and she seems to think her tubes are so destroyed that can't be done, but very often it's not so terrible, and we can reconnect the tubes, and they can just get pregnant naturally. But their other option is to do IVF. So what she describes is, can we just retrieve her eggs? Can we fertilize them in the husband's sperm? Can we place them in the uterus? Oh, yes, absolutely. So the only thing that would get in the way of her getting pregnant is if, let's say, she had her tubes tied when she's 35 and now she's 45. The eggs will be older, and so those eggs just won't be as good. There's going to be a low pregnancy rate from those eggs, but we certainly can do IVF.
What is one thing you would tell people, Julie and Patrick, considering other IVF options or other offices?
We did consider another office. Everybody has different beliefs and tactics, I guess. I enjoyed that Dr. Silber was very adamant about how many we would put in. He really truly believed that multiple pregnancies it was not good for the body. Mm-hmm. And he made that very known to us, which I appreciated, which some of the other people were willing to just put in as many as we wanted or you liked. And I think that was big for me. What about you, Pat?
I think we were recommended to the doctor, and you were recommended, and me. Let's research, and I think if anybody looks up Doc,
you're the best.
You're the best.
So it's hard to compare him to anybody else.
Yeah. Oh, wow.
It's true.
No, I mean,
you're making me blush.
Who's better than you? I couldn't find anyone. Otherwise, I was going to suggest him. So.
And we were all very impressed when we got to see your video on the Today Show and all. It's really cool.
You know that wasn't planned. It really was reality TV. We had no idea. We didn't select that patient. It was just a random person that was willing, a random patient that was willing to do it. Yeah, we had no selection, didn't know what was going to happen. And the idea was, if it doesn't work, she has bad embryos, if she doesn't get pregnant, this is reality. We just wanted to show what was in real life. And it was just like that. Bingo, first transfer. Beautiful.
Right. Nailed it.
Nailed it. Just like that, she got pregnant. But it's, that you mentioned, you embarrassed me with that compliment, but you know that I'm bragging, I'm the oldest living practicing IVF doctor in the world.
Well, you don't look.
I'm serious.
Oh, really?
I'm the oldest living practicing IVF.
Well, you still got it, so keep it up.
Well, that's a note to everybody that you better get it in now. he may retire soon.
No plans to retire.
No plans?
Yeah,
all right, good.
And I swim a mile every day.
We may need you one more.
You swim a mile every day?
Yeah.
Well, he's not going anywhere.
One patient wants to know what are the chances of a 45-year-old woman having twins?
Well, it can happen. It's really remote, but it definitely happens. And I'll give you an example, an interesting example. One of our son's friends, the family, they just wanted to have lots of children. Now, they didn't stop at 8 and used no birth control. And she had 13 children and thought it was all over. And at 45, she became pregnant with twins and delivered healthy twins. So that's a total of 15. Kids are all happy, by the way. And interestingly, when I was just a very, very young doctor in Melbourne, Australia, and wasn't even a fertility doctor, I was a microsurgeon and a kidney transplanter in 1973. Our neighbor, who was a visiting professor also at the University of Melbourne, she was 45 years old, stopped using birth control pills a long time ago, figured there's no way she's going to get pregnant again. And while we were in Melbourne there, she was shocked. She screamed, "I can't believe it, I'm pregnant at 45. So we know that it happens even without treatment. But statistically, you should know the majority of natural twinning occurs in women who are over age 38. Okay. Now, they're less fertile, but they have less eggs, and so their FSH is higher. And so if there's going to be a twin, it's more likely to occur in an older woman than in a younger woman.
Interesting.
Yeah. So it can happen at 45. Not too likely, but it can happen.
Interesting.
And in the case of IVF, you would probably do a couple embryos for a woman in her 40s. Is that correct?
Yeah, right. We have no problem with that because we know that she's not going to have dangerous multiple pregnancy. Yeah.
Wow.
Could you guys tell us a little bit more about the timeline from deciding you were going to do IVF to getting pregnant or then having the baby?
Yeah.
How long that's been?
Oh.
Whoa. Okay, this is when you hand the baby over to your husband.
If you guys couldn't hear that, she went to the bathroom. she's a pooper.
Oh, she's gonna feel really good now.
Yes, she is. We met with Dr. Silber in July. And after meeting with him, it took a couple of weeks to determine what we wanted to do. We did our first egg retrieval in September of that year. After the egg retrieval, we had to take time to get my body healed back up and take a few months off. So we did our first transfer in November of last year, so almost a year ago today, basically. Then when that did not go through, we took some time off and we did our second transfer mid-February. And we found out we were pregnant at the end of February. And then Harper was born this past October 22nd. So a little bit about a year and a half from the time that we met with Dr. Silber.
She's only 4 months old. 4 weeks old, I mean.
So that doesn't include the previous doctors, but the IVF cycle. That was about our timeline.
Yeah, your husband mentioned, Patrick mentioned that often couples will go through a lot of what seems like simpler earlier treatment.
Yes.
While the eggs are getting older. The husband might go through some stupid operation like a varicocele to try to raise the sperm count. It doesn't. You might go through a lot of IUIs, laparoscopy. There's a lot of preliminary stuff that seems to be less radical than IVF. But really and truly, that's not a good approach anymore because IVF isn't so radical. And if you wait till your eggs are going to get older, that curve of pregnancy rate per egg goes down very dramatically. So you don't want to, you almost waited too long because you're 36 now.
And that was going to be my comment. Yeah. The one major lesson I think we learned was that by being diagnosed with PCOS, we look back on the previous efforts and think, hey,
we feel like we wasted some time.
Feel like we wasted some time. So by coming to doctor and being able to get that diagnosis, it's relief, right? It's like, hey, we figured out the problem. Let's move forward.
Yeah.
But yeah, I mean, anybody that considers or thinks that they may have that condition or any other condition should go straight to the expert.
Yeah.
And don't waste your time.
It's not just your anxiety. What happens is your eggs are getting older.
Right. So yeah, and that we talk about, we feel like we wasted time. And then that time was also, like he just said, anxiety and it causes tension and a pain and everything else.
Drugs and emotions and
Yeah.
What are some of the causes of poor egg quality in a young patient?
Oh, okay. So that question is, what if you're a young patient? By young, I guess you mean in maybe your 20s, early 20s. Yeah. So it's a continuum. The eggs are always declining in quality as they get older. By quality, we don't mean the quality of the baby. If you're 45, you have a baby and it isn't Downs, then everything is completely normal. There's no age-related decline in quality of the baby. In fact, older women tend to have, if anything, babies that are more intelligent, and I think that's because they wanted the baby so badly. And they're not distracted by other things in their life, like a 22-year-old trying to get a degree or save up money. And so older women, by and large, I think because of the importance of the first 3 years of life, I think older women, it's pretty clearly have, on average, in a big population, more intelligent babies. But what about these young women who have poor egg quality? It can be an artifact just because they're overstimulated with too much drug. You really need to use the lowest possible stimulatory drug to get the best quality eggs. And a study that came out of Michigan, actually, a couple of years ago, Valerie Harper wrote it. I'm forgetting. But at any rate, it was a very, very beautiful study of 650,000 cycles, statistical analysis done in the United States. And it was a beautiful, we call it multivariate regression analysis. And you look at all the factors, and the live baby rate per stimulated cycle was inversely related to the total dose of drug. So that is, the higher the dose you gave to try to push out more eggs and get more embryos, the lower was the live baby rate. So clearly, and that's a huge study. So too big a dose can artifactually give you the appearance that she has really bad eggs, and it may not really be an intrinsic problem with her eggs at all. There are a small number of women that have an intrinsic problem with their eggs, and even though you stimulate them exactly beautifully, and they're in their early 20s, you get terrible embryos and they don't get pregnant. So the question always is that caused by the sperm, or is that caused by the egg? Very, very hard to study that. But I think most people now know when that happens, as long as you're doing ICSI and you're picking up good sperm, that it's the egg, it's her intrinsic problem. It's sad, but then we get into the issue of donor eggs. And at some point in time, she would need to use donor eggs. And that's a whole subject. Most people don't want to have donor eggs. They want their own eggs. But when we've had to use donor eggs, and we've done that since 1986 for women that don't have good eggs, and we don't have any unhappy stories. So no one wants to face that dilemma, but if they face that dilemma, it turns out okay. That's kind of a long way of answering what is the cause of poor quality eggs in young women. Well, the cause of poor quality eggs is 98% of the time just the aging of the egg. But it can also be an intrinsic problem, and in that case it would be either drugs she's on, medication she's on, smoking, or it could even be just intrinsic in her genes.
Is there anything else you guys would like to add for viewers out in Facebook?
For me, this is something that I never thought that I would ever have to do. I never went into life thinking I would have trouble having a baby, but it's the process is definitely worth it, to tell you. And so if you're struggling, just know that you're not the only one out there. I know there's other people that have gone through it. It works. I'm cheering up. But if you're thinking about coming to Dr. Silber, he's great. He did it for us.
And if anybody's worried about these babies being born from technology, we have 10 million of them in the world now. The statistics show there is no untoward effect caused by the fact that it was your sperm injected into her egg and cultured in an incubator for 5 days before transferred. That does no harm. It's really pretty amazing.
It's pretty cool. The pictures are in her baby book. we have the little circles in her book. So yeah, pretty cool. Do you have anything, Pat?
No, just to ask questions and whatever's on your mind. Doctors seem to understand. It wasn't the first time you've heard them, and sometimes you're reluctant to ask the hard questions, and we did, and it wasn't the first time you'd heard them. So
you have to interrogate the doctors.
Yes.
Interrogate, if that's the word. But
well, what I mean is really intensely look into it.
Personally, it's personal questions, and it's hard sometimes to ask those. But Doc, you answered everything, made us feel comfortable, and that would be my recommendation, just to ask whatever's on your mind.
Yep, and go where you're comfortable.
Yes.
If anybody has questions, which they will because we're out of time, you can go to infertile.com anytime you want, or you can call the Infertility Center of St. Louis anytime you want. And there's no cost or charge, as you know, for any consultation.
Yeah.